Thank you for joining me for this talk about co-producing a randomised controlled trial. My name is Dr. Lucy Goldsmith. In co-production, the knowledge of people with lived experience of mental health problems is used throughout the project to inform key decisions, and power is shared. Previous literature covers the principles of co-production, and co-production is an emerging approach in quantitative research. In this project, we wanted to give worked examples of how co-production in a randomised controlled trial context can work in practice. In this research, we used two methods to illuminate and document co-production in the trial. First, we reviewed the minutes to identify how, when and why decisions which shaped the research were reached and the potential impact of these decisions. Second, members of the team who were involved in either making those decisions or implementing them wrote reflections. We used a sequential method of analysis in which accounts of these meetings and our reflections were iteratively co-edited. I will present the co-production of the case statistical analysis in this talk. The intention to treat analysis was the primary trial analysis. It was specified in the protocol and there was no real scope for co-production later in the project. An ITT analysis analyses participants as randomised. In essence, it is an estimate of the effect of the offer of treatment. We can additionally examine the effect of treatment receipt using a case analysis. For this, a definition of what constitutes having received the intervention is needed. The investigator team and the trial management group both have representation of lived experience within their members. Initial discussions with these groups decided that input from the lived experience advisory panel and service user researcher team was needed to inform the definition. One of the trial statisticians held workshops with the lived experience advisory panel and service user researcher team. These meetings introduced and explained the statistical analysis plan as a whole, indicating where and why certain analyses had already been decided and where there was scope for more co-production. Discussions on the case analysis included how many contacts between participants and peer worker were enough to define receipt of treatment as intended. The statistician and chief investigator suggested a single contact is potentially beneficial. However, notes from the service user researcher consultation indicate that the first session often just covers basic logistics of how to be in contact and when to meet and doesn't really deliver peer support. Service user researchers also suggested that a session in the community following discharge indicates that the participant has chosen to engage with the peer worker. In hospital, the participant may have been visited by the peer worker without actively deciding to engage. From these discussions, it was decided that the threshold for receipt of intervention of the case analysis is at least 2 contacts with the peer worker, at least one of which should be in the community post-discharge. Service user researchers working on the project were positive and felt like co-production has worked really well in this area. The statistician, reflecting on the workshops, said that the input from service user researchers and the lived experience advisory panel was vital in deciding what assumptions were reasonable to make in carrying out this analysis. In conclusion, co-production challenges and potentially changes aspects of randomised controlled trial methodology through the inclusion of a wider range of voices in the research decision-making process, including non-traditional expertise, such as the lived experience of people who have used mental health services. Randomised controlled trials can be conducted in a way which incorporates and values service user perspectives, which can deliver research with greater social accountability, higher quality, and which is more relevant to service users and their journeys through mental health. Please use the paper here for more detailed examples of co-production in the enriched trial and get in contact if you have any queries. Thank you for listening.